Hello, this is a Volumatic Device and it's for use with meter dose inhalers such as Ventolin. The advantage of the Volumatic Device is that it doesn't require the coordination that using the meter dose inhaler on its own needs, i.e. pressing down the canister while breathing in. The other big advantage of using a Volumatic Device is that it tends to deliver the drug further down into the lungs where it is needed, and less drug is deposited on the mouth where it's obviously not needed. So to use it, it comes in two halves. So you line up the two halves along the grooves and they just click into place. You can hear a little click. Then shake the inhaler, as you would if you were using the inhaler on its own. Take off the mouthpiece, insert it into the end of the Volumatic, opposite the mouthpiece of the Volumatic, like so. Now, like you were using the inhaler on its own, before you put the mouthpiece into your mouth, you breathe out as far as comfortable. Then put the mouthpiece into your mouth and put your teeth gently around it and form a tight seal with your lips. Just be careful not to cover the holes at the end of the base here. Down of the mouthpiece with your lips. So once you have it in your mouth, then you press down once on the inhaler, and then you can do one of two things. You can either take a deep breath and hold for 10 seconds like you would if you were using the inhaler on its own, or you can breathe in and out easily 5 times. So I'll go through both techniques. The first thing you do is breathe out. Then you put it into the mouthpiece into your mouth, press once here, take one deep breath and hold, and then exhale. So you can see if you don't have the coordination using the inhaler with pressing the canister and inhaling, use the Volumatic Device. So that's the first way to use it. If you're very short of breath and feel that you couldn't take a deep breath, the other way of using it, in this case, would be to do the same thing, press down once on the inhaler and the canister, and then breathe in and out 5 times. There's a little valve here in the mouthpiece and you should see it moving and hear it clicking as you breathe in and out. So you'll know after the 5 times. So there are the two ways of using the Volumatic with a meter dose inhaler, such as Ventolin or Becotide. It's important to clean it correctly also. You take the two halves apart. You don't take the valve apart, just take it into two halves and put them into lukewarm soapy water. Leave them for about 15 minutes. You can use a mild detergent. And the important thing is when you're drying it, not to use any towels or cloths, and never wipe the inside of the Volumatic. Just leave it drip dry on the counter. If you were to wipe it with a cloth, it causes static electricity, so the medicine will stick to the sides of the device as it goes through. So just use soap and water and leave it drip dry. It should be cleaned before you use it for the very first time, and once every 4 weeks after that. So that's how to use a Volumatic Device properly. Thank you for watching.